Hey, Dr. McNamara here with my lovely wife and assistant, Alessandra, and we both had recently completed a half marathon turkey trot in Schaumburg this past weekend, and we had a lot of fun. It was a little bit cold, but we ran well, and it was a great way to burn off those extra calories we got on Thanksgiving. But unfortunately, Alessandra has been suffering a little bit of nagging hip discomfort slash maybe a little bit of pain, and we think she might have strained her hip flexor a little bit. So we're going to do a little bit of examination and figure out what's going on exactly with that hip. So Alessandra, you want to show us which side is actually hurting when it comes to the hip and what movements seem to irritate it the most?
It's my right side, and when I put pressure on this leg, standing on it to like tie a shoe, put on the sock, that kind of hurts. It hurts right here.
Okay.
And if I like move a little bit, like that hurts.
Okay, and no pain going up or downstairs or anything like that? Nothing in the knees?
I mean, even just walking around, I can feel it. It's kind of tight here, but no, nothing in the knees.
Okay.
No.
Well, based off the location, it appears that it might be the tensor fascia lata that might be irritated. That's why I asked the question about the knees to see if it's affecting the IT band at all. But we'll go ahead and do an examination to see exactly what's going on with that right hip. Then we'll show you a little bit of a treatment and then some rehabilitation exercise that's going to help heal the strained muscle. So, Alessandra, if you would, go ahead and lay face up on this table here for me. Yes. Since the right side is the affected side, I'm going to start with the left side first. Okay. Just tell me if you feel any pain in the hip or the low back.
Nope. Just tightness in my hamstring.
No. That's not too bad. External rotation looks good on this side. Okay, let's check the other side. Good. Anything? Okay.
Yep.
Yeah. So you can see there's a little bit of a decrease in the external rotation on this right side compared to the left.
It hurts in the
And
hip.
she's even feeling a little bit of pain and compression in the hip here. All right, so go ahead and turn on your side, whatever side's more comfortable for you. Oh, we're done.
Oh, sorry.
Anything there?
No.
Okay, go ahead and go face down for me now. Okay, so now the right hips. We're going to again start with the left side and then go to the right. Is there any pain here?
A little bit in the lower back.
Okay, here?
Still like
Lower back a little bit? Anything there?
No.
Okay. So it does seem to have a little bit of lower back on the contralateral side, a little bit of low back pain as well. Any pain here?
Yeah, lower back.
Lower back still? Okay. Same side, left side?
Yep,
Oh, okay. And there. It is pretty common to see as you move from joint to joint, kind of there'll be contralateral symptoms from the joint below versus the joint above. In this case, the hip is painful on the right, but it's actually affecting her low back on the left side as well. Okie dokie. Just want to do one more test real quick here. How's that strain feel there? Anything? You feel it there? Okay, what do you feel at most on that side of the hip? You feel that in the back more still? Okay. So because of those low back attachments for that psoas muscle, a lot of times if you're feeling pain in the front of the hip, it could actually be stemming from your actual lower back. Any pain here? There is? Low back still? And just do a leg extension here. Any pain? And then do one here. Any pain there? Did it feel even on both sides?
Well, I feel like I can get higher on this.
I saw that as well. So we probably have a little bit of pelvic unleveling, and that's also affecting her range of motion and extension. So we'll go ahead and do a quick adjustment, and then we'll do a quick retest with those leg extensions and some of those other tests and see how it feels. So we're going to go ahead and adjust her lower back and pelvis, and then we're going to do a little retest to see if any of these symptoms improve. Alessandra, go ahead and face me on your side. We're just going there. We're going to go like that. Yeah, there we go. Okay, other side up. There's a little one there. Now for the affected side. Whoa. How'd you do that?
It's giant.
Oh, a little meat pot there. Ooh, that was a big one. All right, so now we're going to do a little bit of the retesting of the test that caused her symptoms to flare up a little bit. So we're going to start with the left side again and then go to the right. And we're just going to test the positive ones. So we're going to do that FABER over here. And again, great mobility right there. You can see the external rotation is awesome. And then let's test again on this side. Let it fall down. How's it feel?
It's better.
It's already feeling a lot better. Still lacks a little bit of mobility, so we're going to work on that with a little bit of stretching and some strengthening. But the pain is no longer there, so that's a great start. Go ahead and flip over for me. Okay. And then how's the low back pain? With that?
Better.
There? And here?
A little bit more still there, but better.
So it's still a little there, but it's much better. And a lot of times it's gonna take a few treatment sessions. And here?
No.
How about that?
Just a little bit.
And then here?
No.
Okay, excellent. All right. So now we're going to show some rehabilitation exercises that Alessandra is going to be doing at home to eliminate these symptoms and to make sure they do not return in the future. So right here I have Alessandra performing a 90-90 stretch because when we did some testing, she was lacking that external rotation of that right hip. So we're going to try to build it up a little bit. And we're going to use a technique called Pale's Rails where she performs isometric contractions both with the stretch and against the stretch in order to increase that range of motion a little bit more effectively, as well as strengthen the musculature around the joint. And now that we got those external rotators warmed up or stretched out a little bit, we're now going to be doing a nice, simple hip flexor strengthening exercise. And anyone can do this. It's a great exercise for beginners. You're just going to activate that psoas muscle by lifting that leg up and lifting it over an object, just how she is doing right there. Now for this one, this is a little bit more of a difficult hip flexor strengthening exercise, but this is a really great one. And hold it a little bit more at the top position because that's going to be an isometric contraction, and isometric contractions have an analgesic effect, so those are great to help with symptoms of pain. So that's great exercise right there. Now that we've done some isolation movements for that hip flexor musculature, now we're going to be doing some more compound movements where Alessandra is performing a lunge, so she gets a really good eccentric contraction of the hip flexors, of the hip flexor complex. Try to get more of a stretch in that back leg. And eccentrics are great for any type of tendonitis, so if it's some sort of psoas tendonitis, this is really going to help with that. All right, and then last but not least, the good old-fashioned couch stretch. You can see Alessandra's got her hip into some pretty deep extension, really stretching out the hip flexors. I also love this stretch because it does a lot of stretching on the quadricep muscle, which is also a big anti-gravity muscle that is used a bunch during running. So there you go. There's a little protocol that should help with any type of hip flexor pain or tensor fasciae lata. All right, so that's a little protocol that we're going to be doing to help Alessandra heal up her hip. We're also going to be making sure she's eating nutritiously and getting plenty of rest. So guys, if you like this type of information, want to see more of it, please like and subscribe for more health and wellness. Thank you.